Introduction. Spinal arachnoid diverticula, SAD, are fluid-filled sacs within the subarachnoid space of the spinal cord that can lead to spinal cord compression and subsequent neurological deficits in dogs. The pathogenesis of SAD is not fully understood, but they are believed to result from congenital malformations or acquired conditions, such as inflammation, trauma, or other spinal diseases. In veterinary medicine, the characterization and clinical significance of SAD are still being explored. This study aims to provide a comprehensive description of the variations in SAD conformation in dogs, and to examine their associations with clinical features, localization, presence of syringomyelia, SM concurrent vertebral conditions, treatment options, and both short-term and long-term outcomes. Background. SAD can be congenital or acquired, with the latter often resulting from other spinal conditions. Magnetic resonance imaging, MRI, is the diagnostic modality of choice for SAD due to its ability to provide high-resolution images of the spinal cord and surrounding structures. The use of advanced MRI sequences, such as single-shot turbo-spin echo and three-dimensional constructive interference in steady-state CISS, has significantly improved the detection and characterization of SAD. Despite these advancements, there is a paucity of detailed descriptions of SAD conformations and their clinical implications in veterinary literature. In human medicine, variations in the conformation of spinal arachnoid cysts have been described, particularly in terms of their cranial or caudal tethering. These conformations can influence the clinical presentation and management of the condition. The current study aims to fill this gap in veterinary medicine by providing a detailed analysis of SAD conformations in dogs and exploring their potential clinical relevance, materials and methods. This retrospective cross-sectional study was conducted using data from the electronic medical records of the Royal Veterinary College's Small Animal Referral Hospital. The study period spanned from December 2010 to December 2020. Inclusion criteria required dogs to have complete medical records and MRI studies available for review. MRI studies had to include a Philips Balk-Rad thin slice 3D balanced turbo field gradient echo sequence to allow for detailed post-processing multiplanar reconstructions, MPR, and accurate assessment of SAD conformation and SM localization. The following information was extracted from the medical records: age, sex, body weight, breed, duration of clinical signs, neurological grade, SAD conformation, SM presence and measurements, concurrent vertebral conditions, treatment options, and outcomes. Neurological examination findings were summarized according to the gait abnormality found for each case. SAD conformation was categorized as either cranial tethered or caudal tethered based on the direction of the CSF dorsal column reduction away from the SAD-associated spinal cord compression. Results. A total of 62 dogs met the inclusion criteria, comprising 12 dogs with cervical SAD, C-SAD, and 50 dogs with thoracolumbar SAD, TL-SAD. The C-SAD group exclusively exhibited cranial tethered conformations, while the TL-SAD group had an equal distribution of cranial and caudal tethered conformations. Cervical spinal arachnoid diverticula, C-SAD. The C-SAD group consisted of various breeds, with Rottweilers and Pugs being the most common. All 12 dogs exhibited a cranial tethered conformation of SAD. The presence of SM was noted in 58.3% of cases, with the syrinx located caudal to the SAD. The median absolute length of SM was 22.1 mm, and the mean SM length C3 ratio was 1.18 plus or minus 0.83. Treatment options included both medical and surgical interventions. Medically treated dogs received nonsteroidal anti-inflammatory drugs or corticosteroids. Surgically treated dogs underwent procedures such as dorsal laminectomy or hemilaminectomy combined with directomy and dissection of subarachnoid adhesions. Short-term outcomes were generally favorable, with 87.5% of surgically treated dogs showing improvement. However, one dog deteriorated post-surgery and was euthanized due to lack of improvement. Long-term outcomes varied, with some dogs continuing to improve while others experienced mild deterioration. Thoracolumbar spinal arachnoid diverticula, TL-SAD. The TL-SAD group included an equal number of cranial and caudal tethered conformations. SM was present in 82% of cases, with the position of the syrinx influenced by the SAD conformation. Cranial to caudal tethered SAD and caudal to cranial tethered SAD. The median SM absolute length was 18.3 mm, and the median SM length L2 ratio was 1.3. Concurrent vertebral conditions were found in 64% of dogs, including vertebral body malformations and intervertebral disc herniations. Treatment options for TL-SAD included medical management and surgical intervention. Medical treatments often involved corticosteroids, nonsteroidal anti-inflammatory drugs, and gabapentin, combined with controlled exercise and physiotherapy. Surgical treatments involved dorsal laminectomy or hemilaminectomy with directomy and dissection of adhesions. Short-term outcomes were available for 36 dogs, with caudal-tethered TL-SAD dogs showing better short-term improvement compared to cranial-tethered TL-SAD dogs. Long-term outcomes were less favorable, with a higher proportion of deterioration noted, particularly in dogs treated medically. Comparison of caudal versus cranial-tethered TL-SAD. Statistical analysis revealed that caudal-tethered TL-SAD dogs had significantly longer SM and better short-term outcomes compared to cranial-tethered TL-SAD dogs. Univariate and multivariable logistic regression analyses confirmed that caudal-tethered TL-SAD conformation was associated with improved short-term outcomes, independent of SM length measurements. Discussion. The study highlights the variations in SAD conformation and their potential clinical implications in dogs. The findings suggest that the direction of the SAD tail influences the formation and localization of SM, with caudal-tethered SAD associated with longer SM and better short-term outcomes. These results underscore the importance of recognizing different SAD conformations when diagnosing and managing SAD in dogs. The study also draws parallels with human medicine, where variations in spinal arachnoid cyst conformations have been described. The proposed mechanisms for SAD formation in dogs, such as CSF flow disturbances and the role of the septum posticum, provide valuable insights into the pathophysiology of the condition. However, further research is needed to fully understand the underlying mechanisms and to explore the long-term implications of different SAD conformations. Conclusion: this study provides a comprehensive description of the variations in SAD conformation in dogs and their clinical relevance. The findings suggest that SAD conformation influences SM formation and short-term outcomes, with caudal-tethered TL SAD dogs showing better short-term prognosis. These insights can aid in the diagnosis and management of SAD in dogs, highlighting the importance of detailed MRI assessments and tailored treatment approaches.